Objective. After listening to this module, you'll be able to identify several societal problems that could be at the very least decreased, or in some cases completely eliminated by health education.
Why health education? So just how important is health education? Societal problems. Health education addresses the most pressing societal issues in our nation. What are some of our biggest societal problems? Suicide and depression. Did you know that suicide is the leading cause of death for 15 to 24-year-olds? Health education addresses emotional well-being, including suicide and depression. Violence. Did you know that in one study, 39% or almost 40% of teens indicated they had been in a fight in the past year, a physical fight, and more than 1/3 reported that someone threatened or hurt them. 13% reported having been attacked while at school or on a school bus during the past year. Health education addresses anger and violence and conflict resolution issues. Obesity. Did you know that we have a very serious epidemic of obesity among children, adolescents, and adults in our country? Health education addresses the problem of obesity. Eating disorders. Although we definitely have a problem with people who are overweight, ironically, we also have a problem with people who are of normal weight or even underweight who are trying to lose weight. Did you know that eating disorders among adolescents and now even children has become more and more prevalent? Health education addresses the problem of eating disorders. Teenage pregnancy. We have a problem with unwanted teenage pregnancy in this country. Health education addresses sex education and teenage pregnancy. Substance abuse. Did you know that in one study, 51% of 8th grade students and 63% of 10th grade students reported having tried alcoholic beverages? We definitely have a problem with underage drinking. Health education addresses alcohol and problems associated with it. HIV and AIDS and other STDs. We definitely have a problem with the number of teenagers who are infected with HIV and AIDS and other sexually transmitted diseases or infections. Health education addresses STD prevention, cancer, and heart disease. These are the top 2 killers among adults. Health education addresses the prevention of these 2 killers, which involves behaviors that need to start as young as possible. Accidental injuries. Did you know that accidents are the leading cause of death for American children and youth? All of these are major societal problems, and major problems are addressed in the health education curriculum. Health education addresses all of these problems and more. Health education works. Research shows that exposure to an appropriately planned health education program yields substantial benefits. Results of the school health education evaluation study found that 50 hours of instruction over the school year made a significant difference in health behaviors and therefore health status of children and adolescents in that community that was examined. Health education addresses behavior modification. Did you know that 7 out of 10 causes of death are related to lifestyle? We're killing ourselves by our behaviors, specifically smoking, inactivity, and poor diet. Our nation's most serious and life-threatening health problems relate primarily to personal decision-making and lifestyle. Behaviors or lifestyle that lead to premature death are developed during the school years. Here's a rationale specifically for school health education. As an institution, the school is uniquely suited to respond to each student's basic need to develop skills for independent thinking and decision-making. Beyond the family, no other institution can do more for child and adolescent health than our nation's schools K through 12. The gap between what is and what ought to be is greater in health education than for most other areas in the school curriculum. Yes, we definitely have a gap between where children and adolescents ought to be with their reading and writing skills and where they actually are, but we also have a huge gap between where we should be with the health of children and adolescents and where they actually are. Health education helps to close this gap. There's been a rapid rise in healthcare costs over the years. Health education focuses on personal lifestyle habits that can dramatically decrease the number of health problems that are so expensive to treat. There is an increasing amount of stress in our society. We're faced with many more stressors and more intense stressors than ever before. Health education addresses stress management. People want health education. 70% of people named health as their number 1 concern. 6 of the top 10 concerns were health related. Adolescents today are less healthy than their parents were at that age for the first time in history. Nearly 90% of all babies are born healthy. Something happens along the way, the development of our lifestyle behaviors, that causes us to become unhealthy. Health education is cost effective. It's estimated that preventing one coronary bypass surgery would save $44,000, and that's actually a very conservative estimate. Here's another rationale specifically for school health education. As much as 1/3 of all Healthy People 2020 objectives can be accomplished in the schools. Schools are the easiest venue in which health education can be delivered. Just some quick information about Healthy People. Healthy People is a government document that comes out every 10 years and lists objectives for us as a nation to improve the health and quality of life among Americans. So Healthy People 2020 includes goals for us to work to achieve by the year 2020. The 3 broad goals of Healthy People are: 1, increase the span of healthy life for Americans; 2, reduce health disparities among Americans; and 3, achieve access to preventative services for all Americans. The objectives to accomplish these goals are then categorized into 22 priority areas. These areas are grouped into 3 broad categories consisting of health promotion, health protection, and preventative services. Many of these objectives listed under each of the 3 headings are directly related to school health education. Again, it's estimated that 1/3 or possibly more of these objectives can be accomplished in the schools. So please know that health education, specifically school health education, is a must. This is probably the most important concept that you could get out of this class, that school health education is absolutely necessary. Students can't learn when they're not healthy. Some say that the 3 R's, reading, writing, and arithmetic, history, science, English, and so forth, are more important than health when it comes to what should be taught in the public schools. I don't want to diminish the importance of the other subjects, but studies have shown that the health status of students affects their ability to learn. So how is a student going to learn to read or write when he or she is literally starving to death or suffering from extreme sleep deprivation or trying to deal with major stressors at home, etc.? So as you can see, there are many significant reasons and a very strong rationale for health education. Think of our nation's health as a cup of water. When the cup is empty or close to being empty, our nation's health is pretty bad. When it's full, we're doing great. Right now, it's close to being empty. We're not a very healthy nation. By taking personal responsibility with your own health and working on some behaviors that you need to work on, you're contributing a drop of water to the cup. Yes, it's only a drop, but it's still a drop. It only takes so many drops to fill the cup. With the school day already crowded, many elementary and secondary teachers wonder how to find time to teach health education, especially middle and high school teachers, because they're not responsible for teaching health. They're assigned to teach a particular subject like history or math or science. Please know that by resolving to incorporate health education into your class, you are adding a ton of drops of water to the nation's cup of health because you're hopefully affecting several of your students' choices. I know that you may not be a health educator, but by including some health education into your classes, you're contributing to filling that cup. And it should be noted that health education can easily be infused into other disciplines, so you can still teach the 3 R's while at the same time teaching about health. Key points. There are many significant reasons why we need health education. And that's it for this lecture.